This video is going to look at some exercises that we can do to help manage or prevent disc pain or lower back pain. We're going to focus on the lumbar region of the back because this is where we typically see most people have problems. Bulging discs are quite normal. It depends whether they're going to cause pain or not, but it's always good to keep on top of them or manage them. This routine will really help with that and help you to continue to train if you do struggle with lower back pains or bulging disc issues. So we're going to start on our hands and our knees. So we want to come knees underneath our hips, hands underneath our shoulders, and just start to move our back in a forward and back motion. We're trying to lead this with our hips, so trying to get flexion and extension through that lumbar. Try to lead this with our hips and our lower back. So a lot of people here, they just tend to go from the thoracics and really make sure we're trying to rotate the hips. So nice big arch down to the floor. And then as we roll through, we just then want to start to bring in our cervical and thoracic spine. So just bring in the head round as we do so. To start with, this might feel a little bit sore, a little bit uncomfortable. Just ease into it. Make sure we breathe throughout. A little bit of a pause at the top of each motion. And do as many of these as you feel like you need to. It should start to feel like it eases up. And we should be able to get a little bit bigger arch every time we go. From here, we want to come to the middle of those two movements, and then we just want to go into some lateral flexions. So from here, we're just trying to get some sideways movements through the spine and the discs. So we're taking our shoulder to our hips and our hips to our shoulder, trying to get them to meet in the middle, trying to keep that back in neutral, so try not to flex or extend. So just going side to side. Again, a little bit of a pause in each position. Make sure we breathe throughout and try and make those flexions a little bit bigger every time, and as our back starts to ease up. If we come back to the middle, drop your hands out in front of you, and then from here we're just going to sit all the way down onto our heels. You want to squeeze your hands out as far as you can, and we're trying to get as low and as flat as we can here. So head tucks down underneath, feel your shoulders come up, and then just trying to reach and stretch with those hands. Trying to sit as low as you can onto your heels. That should feel like a nice relaxing position. So we want to try and stay there for a good 5 or 6 breaths. Reset, so come back to the start and then just lower yourself down again. And every time we repeat, you should be able to get a little bit lower, a little bit further down. Again, might just feel a little bit uncomfortable to start with as we're flexing our spine. Make it nice and comfortable, nice and low. And then relax and breathe. Again, stay there as long as you feel like you need to. From here, we're going to bring our hips up, all the way forward, down to the floor, lie flat for a pause, and then we're just squeezing up, trying to keep your hips low and your shoulders high. Relax through your shoulders, looking up to the ceiling, trying to extend that lower back and spine as much as we can. Again, make sure we relax and breathe here. And that will feel easier every time we come back to it. Repeat that or reverse that. So lower yourself to the floor and then sit yourself up. Drop your hips all the way back onto your heels and repeat that child pose position. Trying to get lower and flatter every time. Really sit those heels down, and then again hold that for at least 5 breaths or as long as you feel like you need to. Bring yourself down to the floor nice and slowly, and then squeezing up. Again, hips down, shoulders high. Relax the shoulders and look up to the ceiling. As you breathe out, you should just feel everything relaxing through your spine. If you want a little left to right wiggle as well, and that should feel quite relieving on the lower back. You want to repeat that at least 3 times, but again, if you feel like that really works for you, you can spend longer in that position. And just work through it and trying to get more movement every time we go. Things should really start to feel like they're easing up now. So again, repeat as much as needed. We're then going to bring our hands back underneath our shoulders, knees under our hips, and go into what we call a donkey kick. So I tend to do a pelvic tilt or cat camel first. So arching all the way down to the floor and then all the way up to the ceiling. And then I want to find the midpoint, lock my back in, trying to keep my back nice and solid. Imagine you've got a glass of water on your back. And then from here, we're just going to, one at a time, kick our leg up towards the ceiling. Keep the knee bent and we're trying to squeeze the glute as we go up. Try not to arch the lower back. So a lot of people, when they do this, they arch the lower back. So try and really lock the back in and squeeze up. 5 or 6 on each side. So again, when we swap, locking that back in, trying not to arch the back. Squeezing up from the glute. Really slow and controlled. Slower on the way down than the way up. And you should feel like you get a nice squeeze in the glute as you push up to the ceiling. 5 or 6 on each side of those, and then same position, we're coming into some abduction, so hip is going to come out to the side, and we're trying to get our knee as high as we can up to the ceiling. Again, trying to keep the lower back locked in, just moving from the hips. Trying to hit 5 or 6 each side. Should feel this a little bit more on the side of the glute working. Again, slower on the way down compared to the way out. 5 or 6 on each, and then we can come back to the starting side and put those two movements together. So we just want to roll our hips round and then reverse, so out to the side, round to the back and in. Still trying to keep your back nice and solid, so lock your back in, keeping it as level as you can. There will be a bit of movement there, but the less movement in the back, the better. We're trying to get our hips to move here. And again, swap and repeat on the other side. Keeping those knees as high as possible. Imagine you're climbing a gate or a hurdle. All whilst keeping that back nice and solid. And again, repeat as many times as you need to, trying to hit 3 or 4 on each side. Have a little breather and relax. We're going to then roll ourselves over, and the next few exercises are all going to be on our back. So we want to come onto our backs, feet are flat on the floor, and then to start with, we just want to roll the pelvis, so the same as the cat camels that we started with, this time on our lower backs or on the floor. So just squeezing our back up to the ceiling, again leading it with our hips. So as we roll our hips through into that posterior tilt, we're squeezing our back into the floor. Try not to put too much pressure through the feet here, so we're using our core to do this movement. Relax and breathe, and then again just rotating the anterior tilt so that pelvis comes forwards and the back up to the floor. If it helps, you can put your hand under your lower back and you should be able to roll and squeeze into the floor and roll it so your hand can fit underneath the gap in your lower back. Again, spend as long as you feel like you need to here. Try and hit 4 or 5, but if that feels really nice, you can roll through that as many times as you feel like you need to. We're then going to roll our lower backs into the floor, really try and squeeze as much as we can here, and then just gently with our back squeezed into the floor, bringing our knees up into our chest, grabbing around the knees, and we're trying to squeeze that in as tightly as we can. Again, first time we do that, it might feel a little bit tight, a little bit sore. Remember to relax and breathe. Keep your lower back squeezed into the floor, so use your core, and then just slowly drop your legs down to the floor. Keep control of them the whole way. Keep your back squeezed in here. Once your feet hit the floor, you can relax. Go into that anterior tilt, so arch your back up to the ceiling, gap underneath the back, and then roll the back into the floor. Big squeeze. Keep the back squeezed into the floor. Bring your knees up into your chest, and then we're tucking them in. Again, you can repeat this as many times as you like, trying to hit that 3 or 4 times, really focusing on back squeezed into the floor and a nice slow lower down of those feet. If you want to make that slightly harder, or you feel quite comfortable doing that, we can do the same movement. So squeeze your back into the floor, bring your knees into your chest, nice big knee tuck, trying to roll so your coccyx or tailbone comes off the floor. Keeping the back squeezed in this time, we're going to kick our legs out in front of us and go as far as you can. If you feel like the tension on your lower back has been lost, then stop. So legs out in front. You should be able to breathe whilst you do this, and then gently lower your legs down from there. If that's painful in your lower back, stop as soon as it gets sore, and then just reset. And progress through that as much as you can. Really focus on lower back into the floor. So if I get my legs out to there and feel like my back's starting to arch, I'm going to drop them down and then just start again. Roll through that and experiment as much as you like. From here, we're then going to bring our legs together. So feet together, knees together, arms out to the side to stop thoracic rotation. And then really gently, we just want to keep in those knees locked together, rotating down to our left. Again, nice and slow. Control it and then relax and breathe. And then gently come back through the middle, dropping our knees down to the right hand side. You might feel a few little clicks or pops, that's absolutely fine. Again, shouldn't feel painful at all. Try and hold this in each position for around 3 breaths. So again, you're doing it on breaths rather than time to make sure we relax and breathe. And you want to hit around 3 or 4 reps on each side. However, if it feels really nice, you can do this as many times as you like. Really trying to rotate the lower back as much as we can so shoulders are staying flat on the floor. And then gently come back to the middle. Take your feet so they're shoulder width or hip width apart once more. And then bring your right foot up. Take that foot across your left knee. And then we're trying to push the right knee away from us as much as we can. Once we're in this position, we're just going to gently try and grab around our left knee or hamstring and pull that back towards us. And we should feel that stretching through the right hip. Try and relax through this position, so it can be quite a stressful one. So make sure we are breathing. If you're comfy there, you can just try and push that knee away from you. The more rotation of the hip we get, the more effective the stretch is going to be. Again, trying to hold and relax for around 3 breaths, so make sure we are breathing. To swap over, drop both feet down, bring our left foot up and across the right knee. Again, trying to push the left knee away from us to rotate the hip. And then when we can, if we can, grabbing around that knee or grabbing around the hamstring and trying to squeeze that back towards us. If we're comfortable, we can just squeeze that knee away, again, to get more rotation. Trying to hold for 3 or 4 breaths. And repeating at least 3 times. Right foot up and across, back into that knee rotation. Hip rotation, squeezing back towards us. Again, 2nd, 3rd time we come back to it, should feel a little easier. Should feel like we're getting more movement in. Relax and breathe. As you breathe out, you might be able to just take that stretch a little bit further. Again, once more on the left side. Squeeze that one in, rotating the hip. And then to the next movement, you want to keep your legs where they are. So left foot is still up across your right knee. Drop your right foot to the edge of your mat or the floor, whatever you are on. And then we're just gently going to bring that knee down and across the center line of our body. Trying to get the knee as close to the floor as possible. Relax and breathe. Should feel this through your right hip, but also slightly through the right lower back. At least a 3 breath hold before swapping over. So left foot to the edge of your mat, right foot up and across, and then just dropping that one down. Also important to note any differences here. So throughout all of these, one side might feel tighter than the other. That might also explain or lead to why we're struggling a bit with our lower backs or our discs. Nice and relaxed, nice, slow and controlled swap. Again, trying to hit at least 3 breaths on each side. So once more on our left side. Really relax into these, you should be able to ease that a little bit further. And again, you can do that as many times as feel possible. Nice one to do before a workout. The last one we're going to finish on is a little bit of a core or strength exercise, and we're going to come into a side plank. So we want to go onto our left side to start with. Left elbow on the floor, left foot on the floor, right on top of left. Squeeze yourself up, nice and high and strong with the hips. Holding this position. Trying to hit 5 breaths here, and then if we feel like we can, we're just going to bring our right knee either into our chest, or we're going to take our right foot up towards the ceiling. To start with, that won't feel quite difficult, so if you can only do one of those, or even if you can just take your right foot off your left, and just experiment with those. If you feel like you can roll through that quite a few times, then perfect. Like I say, to start with, you might only just be able to do 1 or 2. Swap yourself over, come onto your right side, exactly the same. Right foot on the floor, right elbow on the floor, and then if we feel like we can, coming knee into chest or knee up to the ceiling. Make sure we're staying nice and tight through our hips, maintaining good form. And you can experiment with that and hold that for as long as you feel like you can, the more the better. that's the full routine. If you can only do sections of that multiple times a day, perfect. If you can run through that full routine once a day, will really, really help with your lower back problems. Thank you for watching and hope you found that helpful.